As parents, we strive to do what is best for our children and do everything in our power to keep them out of harm's way. We would never dream of knowingly put them in danger. Imagine how frustrating it would be if we had to rely on the outside world for their safety. What if we could not do everything to keep them well and we had to rely on the decisions of other parents for our children's safety? I'm going to be discussing the importance of vaccines and why every child that can receive vaccines should receive vaccines. Not all children are candidates for vaccines. Some are born immune suppressed, others have allergies, and some may be going through chemotherapy. The parents of these children have to rely on the parents of other children to vaccinate their children to keep their children safe. This concept is called herd immunity. Herd immunity is a principle where a sufficient proportion of the population is immune to an infectious disease, whether through vaccination or having the illness, to make it spread from person to person unlikely. Herd immunity is declining these days due to the anti-vaccine movement from the 1990s. Many of you probably didn't know that in 2008, Idaho had the lowest immunization rates in the entire United States. Our children were the least protected. Also, I'm not sure that all parents know that in Idaho, childhood vaccines are provided free of charge to every child before their 19th birthday. They're funded by the government's Vaccine for Children's program. I'm going to be talking about the top reasons why parents don't vaccinate their children and hopefully alleviate some fears. We're going to separate some fact from fiction. Vaccines and autism. The theory that vaccines cause autism was first suggested by pediatric gastroenterologist Andrew Wakefield in 1998. Since then, Wakefield's paper has been discredited and withdrawn from the Lancet. Wakefield has lost his medical license and has been charged for showing callous disregard for children's welfare. Since 1998, there have been countless large and comprehensive studies looking for a link between vaccines and autism, but the evidence keeps coming up negative. There is no scientific evidence that links these two. A group of experts, including the American Academy of Pediatrics and the Institute of Medicine, agree that vaccines are not responsible for the growing numbers of children now recognized to have autism. In February 2009, the law supported scientists' conclusion in this arena with 3 rulings from the section of the U.S. Court of Federal Claims, which stated that vaccines were not likely the cause in 3 unrelated children. The U.S. Department of Health and Human Services said in an online statement following the ruling, "The medical and scientific communities have carefully and thoroughly reviewed all the evidence concerning the vaccine autism theory, have found no association between the two." Noting the volume of scientific evidence disproving this link, an executive member of the nation's foremost autism advocacy groups, Autism Speaks, recently stepped down from her position because she disagrees with the group's continued position that there is a connection between vaccines and autism. Vaccines have never been tested. When people claim that vaccines have never been tested, they usually mean that they haven't undergone a randomized placebo-controlled trial, or an RCT. To do an RCT of a vaccine, you need to take 2 groups. Give one kid the vaccine, one group, give them the placebo. Then expose both groups to the disease to see which one survives. Raise your hand if you see the problem here. Not only would such an experiment be unethical, it's unnecessary. We have extensive evidence demonstrating the effectiveness of vaccines, the eradication of smallpox, the near eradication of polio, just 2 examples. Too many vaccines can overwhelm the immune system and cause adverse reactions or illness. Children's immune systems are capable of combating far more antigens than they encounter through immunizations. In fact, the jury is still out on if there's an actual limit on how many they can have, though one study puts the number right around 10,000 vaccines in one day. Currently, there's even less of a burden on the immune system today than 40 years ago, says Edward Marcuse, a professor of pediatrics at the University of Washington, who works on immunization policy and vaccines. He points the whooping cough vaccine as an example where there are far fewer antigens in the shot than the earlier version decades ago. CDC reports that most adverse events are minor, temporary, such as a sore arm, mild fever, and that so few deaths can credibly attributed to vaccines that it's hard to assess the risk statistically. Of all deaths reported to Health and Human Services between 1990 and 1992, only one is believed to be even possibly associated with the vaccine. The Vaccine Safety Data Link Project, which is an initiative of the CDC and 8 healthcare organizations, looks for patterns in these reports and determines if the vaccine is causing the side effect or if the symptoms are coincidental. DTaP and SIDS. One myth that won't go away is that DTaP vaccine causes SIDS, or sudden infant death syndrome. This belief came about because a moderate proportion of children who die of SIDS have recently been vaccinated. On the surface, this seems to point towards a causal connection, but this logic is faulty. You might as well say that eating bread causes car crashes, since most drivers who crash their cars have eaten bread within the last 24 hours. If you consider that most SIDS deaths occur during the age range of 3, when 3 shots of DTaP were given, you would expect DTaP shots to precede a fair number of SIDS deaths, simply by chance. In fact, when a number of well-controlled studies were conducted during the 80s, the investigators found nearly unanimously that the number of SIDS deaths temporarily associated with DTaP vaccines was within the range of normal that was expected to happen by chance. In other words, the SIDS deaths would have occurred even if no shots had been given. There's no argument that parents are doing what they believe to be in the best interest of their children. No parent wants to put their child in danger. Studies have shown that the parents who forego vaccines are generally very intelligent and well-read. They believe that they've done the research and have made an informed decision. Unfortunately, with a subject like vaccines, it can be so controversial, it's easy to read the wrong information. A simple entry, vaccine safety, into Google brings up some of the most common websites that have legitimate sounding names and addresses. Vaccine.net is the 3rd most popular choice, just below the CDC and the National Institute of Vaccine Safety. Vaccine.net is actually an anti-vaccine site, funded primarily by lawyers with unfounded, frightening, and dangerous information. It is for this reason it is also important when searching for information about vaccines to do the homework on the watchdog sites as well. A person can never have too many facts. However, as shown by Andrew Wakefield, even one misleading study can have harmful effects that are felt around the world. I urge parents to keep all kids safe by doing their part in preventing illness and disease by vaccinating. There are many resources available for parents who do the research.
How was the time?